Bruce, thank you for accepting my invitation.
Rod, thank you for inviting me. I've been looking forward to this.
So I heard first time about you as the guy who found out that the biological view of addiction was to a bare minimum too limited with the rat park. That's the first time I heard about you. So okay, there's this guy, and he found out that the rats don't care so much about the drugs if they can actually have a life. And
Yeah, now we're going back 50 years.
right, and surprisingly, I didn't hear about it when I was in my first grad school 20 years ago. I heard about it much more recently. So when I go to read your materials and I start seeing your ideas and the concept of dislocation and your views on addiction, it blew my mind. So you did that paper, that research 50 years ago, the Red Park.
Almost 50 years ago.
Almost 50 years ago. And what was, so the listeners understand the size of this thing, what was if we can translate, what was the finding?
Well, I have to give you the background before the finding.
We have time.
The background is that in the 1970s in Canada, everybody believed that there was a drug called heroin, and that this drug had the effect of making people completely out of control. It took away people's willpower, and it was therefore irresistible. Once you have taken it a few times, that's it. It's all over. Everyone believed that. And part of the reason they believed it was, of course, it was in the newspapers and it was part of the culture. But another part of it was that there was a whole series of rat experiments, which took single rats and put them in isolated boxes with a little lever on the wall where they could press the lever and get a little shot of heroin through a needle, which was implanted in their jugular vein. And it was true, and it was shown over and over again, that the animals, many of the rats, would take very large amounts of heroin. Some would take it to the point of actually dying of starvation. They just keep pressing the bar for the heroin. Now there's the proof, and you couldn't want any proof greater than that, unless you stop to ask yourself, now wait a minute, this is a rat in solitary confinement. Could it be that what we're seeing is the desperation, the kind of insanity which goes along with spending a life in solitary confinement? And you could ask, well, is it normal for rats to be alone? And the answer is no. Rats are colonial animals. They live together always. So my students and I, and I have to say, I get credit for this experiment, but there were several of us doing it. My students and I thought, well, why don't we just set up a place which is a little bit more natural for rats? And so we made a big box on the laboratory floor, roughly the size of a garage, because the place that in Vancouver in those days you were most likely to see rats is when you went out to get in your car in your garage, and there are the rats running around having a good time and being happy rats. So we tried to more or less model that, and gave the rats access to heroin and compared them to rats in solitary confinement that also had access to heroin. And the rest is well known, that the rats in Rat Park didn't drink very much of it, and the rats in the isolated cages drank a lot of it. But it's even more complicated than that. And more interesting than that, because some of the rats in Rat Park had some of it. And, it looked like, from time to time, a rat would go over and take a good dose, and then they wouldn't take any more. So it wasn't that they didn't use the drug, so to speak, but they didn't use it in an addictive way. And so this we thought at the time this was going to change the world because this disproved the rat experiment, which was convincing everybody that the drug was irresistible. But it didn't change the world. Nobody paid any attention to it until decades later. And so you've mentioned that the first time you were in graduate school, you didn't hear about it. Well, yeah, most people didn't hear about it until now. Lots of people know about it, and it's been publicized. It hasn't been publicized so much through the graduate schools as it's been publicized by popular writers, people like Johan Hari and so forth. And so that changes the world, right? It says we gotta address this drug addiction problem as a real problem, not just a demon possession problem. You know, there's no magic here. There's no drug which if you take it, you can never stop taking it. There's no such thing. So we gotta face the problem in a much more real way.
That I would believe not only changed your view of addiction, but also probably led you to, you know, explore other ideas in the field, because clearly the whole the reductionist biological view of addiction cannot really explain those events. And in a sense, I think we see that a lot. But I want to hold this comment and ask you, knowing that you have a specific view of addiction, not so specific because it's a historical view in so many things. Do you mind tell us about that?
Yeah. Again, let me tell you the background first.
Of course.
Which is that I went to school to study chemistry, and I'm very scientifically oriented. And so when I changed my major eventually to psychology, I changed it to what seemed to be the most avant-garde scientific form of psychology of the day, which happened to be behavioristic psychology, which focused on rats and monkeys. So that's what I studied. And it's very useful. I think it's a useful kind of a field. It's just that it has gotten nowhere on problems like addiction and some other psychiatric problems. It's gotten nowhere on those. And so I eventually came to realize that I was not going to understand, no matter how much I studied rats, I was not going to understand addiction. And so I with the help of some good friends and some good colleagues, started, wondering where else can I go to learn about addiction. And the next logical step, if you happen to live in Western Canada, as I did, was to look at the history of the settlement of Western Canada, because when the settlers came, the Europeans came here. Western Canada, that wasn't very long ago, it was only a couple of 100 years ago. When they came here, they brought two diseases, which were smallpox and alcoholism. And they were both, very serious diseases among the colonists. They brought those two diseases and they cured one of them. The smallpox has gone away. We don't have it as a problem anymore. It has been controlled by scientific medicine in a very, very good way that you would know about. And the other one has only gotten worse. So we use the same scientific evolution that we've been going through in medicine in order to combat both those problems. One has succeeded, the other has failed. And so I concluded, we're not going to solve it scientifically. For all kinds of reasons, not just the apparent failure, but also the difficulty of being scientific about something like addiction. Like, addiction is something almost everybody has seen it in their family or in themselves, or certainly in representations on the screens, in the movies and all this. Everybody's seen it. Everybody has a strong opinion, especially if you've seen a parent. I have seen a parent die of addiction. You can't do that without forming the strong opinions, and so it's not something which lends itself to objective science. I think it lends itself much better to historical study. So, so I started studying the Indians of Western Canada because they have this amazing history with respect to addiction, which is that they had virtually no addiction until they were colonized. And then many of the tribal groups, many of the villages had 100% addiction. They had virtually everybody was alcoholic or they were on the wagon. Um, and so I started studying that instead of rats, and that turned out to be much more useful, but led in the same direction. Because what happened was that, like, first of all, these native Indians are, they're not super duper human beings. They're just human beings. They have all the problems that other people have. They have war and they have slavery and they have cruelty and they have betrayal and everything. They have the full range of human problems, but not addiction until they get colonized. And what happens when they get colonized is, in my mind, related to what was going on with those rats, which is that when they get colonized, their elaborate social structure, their elaborate societies are crushed. They've got no society left. They may still live in a village with a bunch of other native people, but the chiefs are no longer chiefs, and the religion is no longer respected, and the language is no longer spoken by the children, and the parents are no longer raising the children because the children got taken off to white school and learned to be white. Um, all that happens, and they get apparently something close to 100% addiction in many of these villages. So now that sounds to me like the same thing. It sounds like in the absence of a viable culture, addiction becomes a much more likely kind of an outcome to the availability of a drug. So when we talk about the natives, we tend to blame it on the alcohol. We say, oh, well, those natives, they just can't handle alcohol like us European guys can. We forget the fact that us European guys don't handle alcohol very well either a lot of the time. Um, and that's not the reason, because there were native tribes, not in Western Canada, but in other places where they already had alcohol. They handled it fine. But when the society is destroyed, addiction follows, mass addiction. And that's a historical fact. We can identify it very clearly in terms of our recent colonial past here in Western Canada, but we can identify it in other parts of the world and in other ways easily.
When you say they didn't have addiction, and knowing that your view of addiction, as I want you to explain, has at least those four types of addiction.
Yeah.
When you say they didn't have addiction, are we really talking just about the chemical part of the addiction, the one that people understand nowadays as addiction, or they didn't have addiction in the sense that you point out that was the actual meaning of the word until the prohibition years or so?
Here's what I know, that these are people of oral history. So you can find their history best by talking to them, by asking them questions. So I've gone to many native villages and I say, tell me about addiction before colonization. Tell me about that. And I say, by I mean addiction, I mean it could be addiction to drugs, of course, but it could be addiction to sex or to gambling, or it could be addiction to just anything. But this idea of being carried away by a devotion to a particular practice which wrecks your life. Tell me about that. And I make sure they know what I mean. And what they generally say is, oh, yes, I'll ask my grandmother. And so in a way, I have a key, a doorway into oral history, and they go and they ask their grandmother, and their grandmother remembers her grandmother. What would she have said? And what the answer that I get is, we don't remember anything like addiction. before um, before colonization. And as I've said, they do remember other problems. They remember war, they remember slavery, they remember all kinds of stuff that was not nice stuff, but they don't remember addiction. And the one exception to that is that in some tribal groups, there's a myth. There's the myth of Wetigo or Wendigo. Do you know this word?
I don't think so. It sounds familiar, but I don't think what it is.
The myth is of a creature, a mythical creature that goes crazy and starts consuming other people. It actually becomes cannibalistic and it consumes human flesh, but it consumes everything. It becomes the essence of greed. This is a mythical creature, and this is something which is taught to children, and the children are taught, you must never do the things which turn a person into a Wendigo, because you wouldn't want to be a Wendigo, and we wouldn't want you to be a Wendigo. So it's not that the idea was unknown to them. It's just that it didn't happen, or if it happened very seldom, so seldom that I can't find a record of it. And other people who have tried to explore the oral history have the same result. They don't. That's not something they find.
Now, knowing that, but that would force us to think that, considering how long European civilizations know addiction, and knowing or considering the concept of dislocation,
Mhm.
we have to assume that it came along, because at some point we have to say, okay, so tribes, Canadian tribes, we have to call that a civilization. They are a civilization.
Yeah.
But some drastic change must have happened in European civilizations, because addiction has been a problem there for thousands of years.
Yeah. And here, as far as I know, the historical evidence is not as clear. Like, we have really good descriptions. By the way, part of my getting out of the science habit was to get into the history habit. So I've done a lot of studying of the history of psychology, as well as the history of just plain history. But we have a couple of really good scholars in ancient history who describe addiction. One is Plato. He describes it perfectly, brilliantly in the Republic. Another is St. Augustine in the Confessions. Now, these guys live 500 years apart. They're describing addiction. And we have to say, well, how are they able to describe addiction? What's going on? Well, they happen to be both people writing in the midst of the downfall of an empire. Plato was writing at the time of the Peloponnesian Wars. Athens was not just a city-state, it was an empire. It was a big empire. They controlled a good part of the Mediterranean, and as they collapsed, Plato wrote his great works on addiction. St. Augustine was writing at the time of the collapse of the Roman Empire. He was writing right around 450 AD, when the barbarians were literally at the gate. They literally came into the gate when he was dying, and they let him live because they were Christians too at that point. But he too was living at the downfall of an empire. So the conclusion that I would like to offer in answer to your very interesting question is, I think the evidence is that historically we see great outbreaks of addiction when civilization is failing, like at the time of the collapse of an empire, or now. I mean, maybe we're at the time of the collapse of a world empire or a world civilization. We're definitely in times of incredible panic and real danger, right? We're facing real danger. We may
Very
not.
ominous. Yes, yes, no, yes. I think we have. I don't want to go there. I think we have enough things happening to support your view, and it's really ominous to think like that, because there's right now economic changes in the world going on that are, I wouldn't say unexpected, but unprecedented in the modern world. But I just don't want to go in that direction because it's not my thing. But then,
Yeah, but everybody's afraid. I mean, that like people are genuinely afraid, and it doesn't matter if they're on the left or if they're on the right or if they're in the center.
yeah,
They're scared shitless,
yeah,
and they have every reason to be. And I think that what we have seen in the last, let's say, 3 or 4 decades, um, is the emergence from relatively local civilizations, societies in Western civilization, relatively local villages or relatively local kingdoms or whatever, to an emerging world civilization which is confused and hasn't coalesced in a organized way. We're struggling. We're our ideas like communism or democracy are failing us because we're not able to put it together in an organized way. And I suspect that the kind of terror that people who I know are feeling is not dissimilar to the kind of terror that people were feeling as Rome collapsed or as Athens collapsed, but that it's been happening over, gradually over a period of time. Now, you can tell I'm going beyond my knowledge here. I'm not a historian, and I don't claim to be. But what I claim is that psychologists and psychiatrists need to look much more broadly at these problems than we are. We've allowed ourselves to be swept into a corner, where we say, well, these problems, well, it's just a little addiction problem, just a little bit of dopamine here and there, and we'll fix this thing up. Well, no, we're not going to do that. What we've got is a grand cultural thing that's happening here. I don't mean grand in the sense of wonderful, but I mean grand in the sense of huge, a huge cultural thing that's happening. And I want us, this is my message to the world, I want us, psychologists and psychiatrists, to open our eyes a little wider and not let ourselves get caught in the position of just being, just the treatment guy. You go to me and I'll tell you what pill to take or what algorithm to follow, and you'll be all better. Well, no, I think we should expect more of ourselves than that.
we still have to get to the split you made on the concept of addiction and the historical view of it, and also I need you to explain to us the concept of dislocation. But those thoughts were exactly what got me to start this podcast, and the second one was when I read this from your website and from your book. I said, my God, I got to talk to this guy, because in my field, and I'm always complaining about this thing, and it's hard to sell this idea. We were sold, and with all fairness, I talked to a lot of people about the topic, and once you talk for a while, the usual take is, oh yeah, I knew that, of course, yeah, because the information is awfully evident and obvious. But our training in psychiatry is not a scientific, because once you start digging the biases in our scientific production, starting with the choice of randomized controlled trials as the gold standard. They are the gold standard. It can only be the gold standard to validating drug trials, and yet they fail. But for anything that is more complex, that involves human behavior, they don't even scratch the possibility of entertaining the complexity of things. And we are trained in a way to think, okay, we don't have evidence of a brain dysfunction for any psychiatric disorder except for dementia, maybe. For dementia, for sure. And in fact, DSM has abandoned any, again, possibly with the exception of PTSD, any causation when it comes to the diagnosis. It's just really it's like a syndromic diagnosis, as simple as it is. And we are told, okay, these things are caused by brain diseases. And it's not as much as we are told, it's just understood and everybody behaves as if. So, and because I get to observe a lot of people working, we don't ask very simple questions like, to what do you attribute your suffering? Someone comes back from had an appointment, comes back and says, well, I'm depressed again. And you hear this frequently, my depression came back.
Yeah.
As if it was an entity that was sitting in a corner, right? Just like some autoimmune disease, just sitting there. And that's why I don't like Foucault or Thomas Szasz, because all their criticism, all the social constructivism is only true in psychiatry. The whole rest of medical field doesn't confirm those things. And so usually they don't, but it's a sad thing that in psychiatry, we have this, the depression came back. It was somewhere, which kind of validates the chronic use of medications, which makes me think, being the eternal medication tweak, because that's what we are in this field. We're medication tweakers. And whoever's listening now, I'm not kidding, whoever's listening now may be upset with that, but I just need people to look at your practice and ask yourself, what have you done over the past month for nearly 100% of your patients, if not a small adjustment, another small adjustment? And that thing ends up being, when you start looking to a more deep functional analysis, if you will, or from a just contextual perspective into the patient's lives, you start realizing that the only novelty they had over the last month was the medication tweak. And I said, I gotta talk to this guy about these things. When I saw what you said about dislocation, I said, no, I wanna hear what you have to say, because it's so awfully similar to what's happening in psychiatry.
It sounds very similar to me, man. I'm hoping you're exaggerating when you're saying that 99% of the people are getting nothing more than medication tweaks. I hope you're exaggerating. I don't know, of course. But that's just a terrifying idea. I think our version of that is we psychologists, incidentally, I like psychologists. We're good people. We care, and we really would like to help. And we're not dumb. We're pretty smart. We're trying hard. But we've allowed ourselves to get into a box. And the box is that we've got these treatments. And these treatments, some of them are new, some of them are pretty old. And they work, sort of. We can show that, we can show graphs which show some effects afterwards. And sometimes it's significantly better than an untreated control group. And that's really good. And we've let ourselves get in the box where we're oversold. So, for example, in my place now, British Columbia, Canada, our big thing today in the news is that we're forcing drug addicts into psychological treatment. And the nurses have protested. That a big group of nurses is writing an article, and they're saying, no, this is crazy, because the psychological treatment doesn't work. And we're forcing people into treatment. We've got to keep them there against their will. They're suffering, and they're hurting people. They're fighting us. It's dangerous. We don't want to be doing this. And what we don't have is psychologists. Now, I tend to like Thomas Szasz, so I'd love to go back to that. But I think we need more, like, I think we need psychologists who are going to say, no, we're not going to treat our way out of this thing. We could help a few people some of the time. Sometimes we do. Hooray, hooray. Sometimes we do, but mostly we don't. And we know perfectly well that most people who get out of the addiction problem get out of it without a psychologist. Now, that doesn't mean they get out of it all by themselves. It means they talk to their grandma or they talk to their friend or their girlfriend or whatever. They find someone who cares and they work it out and they get a new idea and they get a new way to live and they can forget about their addiction. Yeah, that happens all the time. But we've let ourselves be oversold. And I remember, like, going back now 30 years, I guess. I remember that there was a time when, the war on drugs was the big news. And every once in a while, some brave policeman would stand up and say, look, I've been busting people for my whole life here and it's not working. We are not going to be able to arrest our way out of this drug problem. And I think we psychologists, and I imagine we psychiatrists too, should be saying, look, we're not going to shrink our way out of this problem, or we're not going to therapy our way out of this problem. We're not going to do it. We have our little contribution to make, and it's not nothing. We can sit and talk to people, and that's nice. They like someone to talk to. It's a little bit helpful, and sometimes it's a lot helpful, but usually it isn't. And when we get the courage to do that, we say, look, we're not going to therapy our way out of this problem. Then we become a whole different kind of a voice. We become a voice which says, now let's look to the origins of the problem. Let's look to the origins and let's look diligently, not just talk about it in a poetic way or an existential way, but in a very diligent problem-solving way, and that hasn't happened yet.
Of course, you're talking about societal changes, but before we get there, I want to ask you to explain to us the split you made in the concept of addiction. Can you do that, please?
The split? Do you mean the two definitions?
The types of addiction. I know in your book you said, oh, there's a type 1, 2, 3, and 4.
Okay, I will if you want me to, really, but I would rather go to the dictionary, because it doesn't matter what I said in my book.
Well, listen, that's quite brilliant, I gotta tell you. And I explain why. One of the things that I found that is very useful, and that I think applies to my field of action, is of my professional field, is the view of people using drugs on and off to get through.
Yeah.
And the other one is really being consumed by something.
Yeah.
And the other sense I had is that you may devote yourself to something productive, like writing books.
Yeah.
And it will be something that sort of, in a sense, devours you, but it's, because we don't ignore that there's one of the many factors associated with the chemical addiction is that the chemical addiction does have a percentage of a life of its own. A small percentage is a contributor. Is not like completely, once it is there, you're going to have possibly cravings for the rest of it. There is a change in your brain, allegedly. But it's also true for any things that you do in a passionate way.
Yeah. Okay, good. Here's how I'd like to approach that.
Please.
I'd like to say that the most important scholar in the field of addiction today is a woman at the University of Southern California called Rebecca Lemon. And she's written a book called Addiction and Devotion in Early Modern England. And everybody in our field should read this book. And what she says, she points out that for the most part, in the time of Shakespeare, addiction was a desirable thing. Like you wanted to be addicted to Jesus, or you wanted to be addicted to your scholarship, or you wanted to be addicted to your master if you were a servant. And this was a positive thing. It means a devotion which surpasses everyday devotion. And you wanted to be devoted to your children. You wanted to be addicted to your children. And the word was used precisely that way, even in the Bible. The King James Bible, the Bible that I read when I was a child, talks about how important it is to be addicted to the saints, and by which it means to spreading the word as the saints did. But of course, in the time of Shakespeare, we also knew that you could be addicted in a dangerous way. You could even be addicted to Jesus in a dangerous way. So let's say if you were part of the Spanish Inquisition in England, in early modern England, that wasn't very cool. You were using your love for God as a way to sponsor these massive burnings of human beings who were said to be heretics, or it was also known you could be addicted to alcohol in that way. It wasn't the primary use of the word, but it was well known. So that's the essential human fact, I think, is that addiction is something which is very much part of the human realm of possibilities, and that it can be a very positive thing, and it can be a very negative thing. Now, after that, if you get up into the 19th century, then the word becomes much more specific, and it comes to be applied to drugs. And we start to say, well, addiction, now, that's a drug problem. We've got to figure out how to get rid of them drugs, right? But that's way later. And that requires sort of asking people to forget the deeper meaning, the older traditional meaning of the word addiction. But the interesting thing is people haven't forgotten it. If you look at the literature, let's say the biographical literature, I mean, the serious biographies, people talk about their addictions to love of one sort or another, to God, or to a person they love, or to their children, or to a sports team. And the traditional use of the word addiction is still in the language, and it's very real in the language. It's just we in our little academic bubbles don't notice it very much, because we want to confine the term addiction to this particular thing of being overly addicted to a drug. But even there, it becomes more complicated than we would like it to, because there's at least two ways to be addicted to a drug. One I think is best called dependence, and that is, people just need a drug and they use it. Like, as I mentioned earlier, my father smoked himself to death. Well, he just needed that tobacco. He couldn't function without it. And the day he died, there was an open pack of cigarettes on his hospital bed. He literally smoked himself to death. On the other hand, there's a kind of addiction where people are really in love with the drug. And you may think, well, nobody's ever in love with tobacco, but in fact they are. There's a brilliant book by James M. Barrie called My Lady Nicotine, which again I think everybody should read. In my new course on the history of addiction, everyone's going to read these books, you see, in which he talks about how his life was made meaningful by smoking society in England. And he would hang around with the other intellectual guys, and they would smoke their pipes, and then he would go home and he would sit by himself and reflect on the wonderful interactions, the wonderful intellectual interactions he'd had during the day, and write a little bit and smoke his pipe. And so he wrote about my lady nicotine as if nicotine was his mistress. And he died of emphysema too, just like my dad. But they were completely different. My dad didn't love nicotine at all. He thought it was dirty habit, and he didn't like it, but he knew he needed it, and he smoked it. So now that's two different things that we call addiction, right? One I think is properly called dependence, and the other, in the traditional sense, I think is properly called addiction, where addiction is a devotion, as a meaningful devotion of a human being. The other is just, I need the drug. And I think that distinction is lost. Like it's very odd in our field that we tend to use addiction and dependence as if they were the same word, when in the dictionary they're not. They're quite different words. And so yeah, again, what I'm trying to say is, I think in the history of the language, and in the history of, as we know it through the great tradition of biography that we have in this history, we learn far more about addiction than we do by tweaking drugs or looking at brain scans.
Absolutely. So far, nothing came out of those brain scans. But you said something made me think of my first grad during psychology grad school. I finished in 2000. Basically, I remember the topic of moving from a chemical, let's call addiction, to some other sort of intense devotion to something.
Yeah.
I remember being treated in terms of symptom substitution,
Yeah.
by psychoanalysts and by behaviorists in terms of the functionality of it. And either way, so I think it's, in a sense, is alive. But again, I did that in Brazil. In Brazil, psychology is much alive, and the theoretical aspects of psychology in Brazil are very alive. And we still, as you go through training, you still don't talk to the psychoanalyst anymore. You just don't make friends with psychoanalysts if you are a behaviorist, and this is still a very intense thing, or it was 20 years ago, God knows. But that leads me to a question, because you sound very despondent when you talk about our role in this thing, and I wonder if you believe that it's because our focus has been, coping strategies, like resist the urges, how can you cope with it, and mindfulness, and this and that. But thinking that this thing that we have been calling symptom substitution or whatever seems to be a real thing. Like someone goes from being a savage addict, like a kind of wild kind of guy, and then becomes a priest or something. And then he only talks about God, or then he only talks about the 12 steps programs or something like that. Do you see using that as a strategy as having any better chance to cope with the reality? Thinking of, like finding, because of course I'm going to talk about meaning now, and finding meaning in life, finding things that you can devote yourself that are actually going to get you moving, as opposed to keep you stuck in the cycle of sobriety, relapse, sobriety, relapse, sobriety, relapse, and get you moving in the sense of devotion to your kids, devotion to a religion, devotion to a cause, or whatever.
Yes. Of course, I want to say that if you look at the data on natural recovery, which I'm sure you have, what happens when people recover? They have a baby, and they realize they've got to take care of this baby in a responsible way. They can't be a drug addict anymore, or they become invested in their scholarship and their university work, or they become invested in their poetry or their art. I mean, I think we see this all the time, and I think this is what we do. Like, I'm a parent and a grandparent, and you are too, I think. And
My grandparent.
yeah, I mean, what do we do? What do we do with our children when we worry about our children? We give them something better to to focus on. I'm thinking of a child that I know who loves video games, too much, to sits and concentrates on video games with a concentration which is scary because it's such total concentration, and it just, he's allowed a certain number of minutes a day, and he only uses those minutes, but he uses every minute. He doesn't waste a second. And I this is an 8-year-old, right? And I see something there that scares me, because I don't think video games are really going to be the best thing for him, for it to be the center of his life later in life. But the only thing that he concentrates on the same way that he concentrates on video games is fishing. So what do? I had no fancy psychology. I take him fishing. Of course. And I think it's likely, if anything is going to help steer his life in a better way, that is. And I think every parent just sort of knows that intuitively. I mean, it's obvious, right? It's so obvious. And but is it obvious to those of us in the field of addiction? I mean, what worries me is, someone walks into the psychologist's office, and the psychologist sits them down and it says, okay, how are we going to get you to stop taking this drug? Well, that seems to me, going at it from exactly the wrong direction. Why don't we sit down and say, well, what could you do that's really exciting? What could you do that you'd love to do? And that would you'd forget about drugs. Don't worry about that stuff. Let's find out what you could do that you'd love to do. And that's what I think you've said. And yeah, why the hell aren't we doing that?
I want to run some thoughts by you. So one thing that I frequently, and this is, I wish I was the first brilliant guy to come up with it. No, this is probably a reflection of everything I've read and seen in the field. But one thing I always one thing I like to do with psychology is to find the commonalities between the thinkers. So I'm going to find a commonality between Jung and Hayes, and I find commonalities between Jung and behavioral therapists and the concept of CBT in general. And I can put personal responsibility on top of locus of control. And I like to do this exercise to the point that I have a mentoring institute where I just go over these commonalities for prescribers.
Well, I want to get the link to that. That sounds very interesting.
So what happens is, the result is that I one day I said, well, it sounds that being alive nowadays, it's easier than was ever before. Just being fed. We have food stamps, we have Social Security benefits. The numbers of people on Social Security keep going up, and they live with the very slightly less than absolutely necessary. So they sit in their couches, they eat, and they pay Netflix. But emotional needs seem to be left aside. And those emotional needs, like, for example, I'm going to quote Seligman that says the PERMA, right? The positive emotion, relationships, meaning, and accomplishments. And which is not that different from Maslow, if you think about it, when he talks about the pyramid of needs. That's a lot of emotional needs there. And one that I always include is novelty, and the other one is entertainment. Okay. And one thing that I noticed, I used to watch a lot of TV. So I met my wife. She doesn't watch TV at all, except for football games. We're big Bears fans from Chicago. We don't live in Chicago. We're Chicago Bears fans. And but I also, as a result of my relationship with her, ended up watching third division college football. Third division. Third division college. It's like small schools, not Ivy League football. It's not like Penn State and Atlanta. It's like small universities that also have a team. Yep. And And what I noticed watching that is that the quality of the entertainment, the quality of the experience is such, the intensity of being there, that I cannot compare with in person watching it. I cannot compare with watching the Bears on TV, for example. And I'm talking about the Bears,
Yep.
okay,
Yep.
that team. But it's still not the same amount of. It's just by the end of it, you feel like, okay, I don't need to play with my phone today. I have had entertainment enough, right? And the other thing that I noticed is that, of course, and I was practicing jujitsu at some point, and I like martial arts. But practicing jujitsu, living the martial art, cannot be compared with a video game of martial arts, with watching martial arts on TV. And my thought was, okay, what happens to us is we're all falling back to these very cheap replacements
Yeah.
for
Yeah.
different reasons, because they fit in life, because, so then we take kids that we're living tough times for the sake of accomplishments, right? 25-year-olds, freaking 50, 40 years ago, the guy was done. Now you're finishing school and you don't know if you can even find a job. So accomplishments, family, those things are so hard to achieve that changing, overcoming, passing a phase, a level, as we call in a video game, becomes an achievable goal, becomes something that's going to take my thoughts as I go to school and I'm thinking of playing the video games. And the other thing that I notice is that a lot of patients, I noticed that with a lot of patients, they come and say, well, I can't sleep at night, I'm not sleeping at night. And then you dig, which usually we're not, I hate to say this, but we're not doing a great job digging. But as you dig, you find out, and some patients will say, well, what happens, doc, is that I get in bed in time, I am tired, but I get caught in a sitcom, TV show, or
Right.
I start seeing videos, funny videos on Instagram, and I just get lost. And instead of sleeping at 10 p.m., I sleep at midnight and I have to get up at 4 a.m. As if you need to fulfill that thing. I know it may sound insane, but as if you need to fulfill this thing, and what you have with the structure, not a big fan of going there, but with the societal structure as we have. And that's where psychiatry gets me, because we're also helping them to stay put. Because they're feeling miserable, they're not finding satisfaction on things. And instead of looking at them and saying, hey, man, have you noticed that your life either has been the same for the past 5 or 10 years? And likelihood is it, if you're lucky, it's going to continue to be the same, if not worse. Where are your dreams? Where are the flame that used to burn in your chest? We don't go there. Positive psychiatry seems to do it.
Oh,
Positive
good.
psychiatry seems to look into these things and say, what is strong about this guy? Let's push for that. Let's go for this strength and stuff. Instead, what we do is, well, if you're feeling down, there's probably something wrong with your brain.
Yeah.
And let's try this medication, right? Or let's try to fix your thoughts, because we've got to fix your perception of things, which is I think is a misconception. I don't think that's what CBT is about, but it becomes that because we are teaching technique only. We're not teaching the spirit behind it.
Yeah. I mean, absolutely. Absolutely. We, you know, we have a very funny function. We who are in the PSY professions and the helping professions, we have a very funny function, which because there's common sense tells us, that we would want a person to find the flame again, let's say, to find a way to improve things and make things better, to find a way to love what they're doing and to make what they're doing happy and make it work for them. But somehow it's not our job, right? Our job is to make the person get to work in the morning, having had enough sleep so that at least keep their eyes open and all that. And again, I think we're in a box, and we don't have to be in that box. I think we get paid well for being in that box. Um, but that's not a good enough reason. And therefore I've listened to a few of your podcasts. I'm impressed with what you're doing, because I think you're pointing towards a new radicalism that that is badly needed. And I think the way to do it is exactly what you're doing, just to say these fairly obvious things, and say them in a way that people can hear them, and to somehow to learn to disregard so much of the wrapping paper, that ideas come wrapped up in wrapping paper as if they're a wonderful present, and you unwrap the present, there's really not much in there. Well, that's what we do. We take something like CBT or something like Prozac, and we put wonderful wrapping paper around it, and it looks like that's going to be the way, that's going to solve our problems, not just sitting down and reflecting on it and with common sense, but we're better than normal, right? We're going to make you better than normal. That was the slogan for Prozac for a time, as you would know. Yeah, how did we get in that box? And how do we get out of that box? Um, and I must say that I've had a lot of good moments recently talking to people who want to be out of that box. That is to say, psychologists who want to be out of that box. I think things are changing, but to me, it always comes back to the larger social structure. I mean, we are a particular kind of a civilization, and there are people whose function it is to keep other people doing what they're doing in a way which makes the wheels go round and makes the gears turn, and we have fallen into that position, but we don't have to do that, especially when we're 83 and retired. We don't have to do that.
So I want to ask you to explain to us how you came across the concept of dislocation, and give us an explanation of it. And then because one thing is to address it in a clinical setting, and then I think we could talk about what expectations we can have in that regard, because I'm as I told you, I'm extremely skeptical of political will. Um, um, on the other hand, I do believe in people tremendously.
I want you to repeat something. You're
I'm very skeptical.
political.
I said political will, but I when I mean political, what I mean by political will is the will of the politicians.
Okay.
I'm extremely skeptical of that. I feel like no help is coming, but on the other hand, I believe in people tremendously. I know how wonderful things we can do, and
Yeah.
atrocious things as well, which goes for my argument that we're capable of amazing things. Um, but I would put much more hope that we can change the field, and the field can make a dent in reality, than politics per se,
Yeah. Yeah.
because we don't have. There's. I may be wrong, but I don't see opposition in the upper levels. They're all on the same freaking side.
I think that we have the wonderful opportunity to talk to our colleagues, and that's what a profession is good for. And I think that our professions, psychology and psychiatry, are changing. And I think it's for the good that they are. But ultimately, I think we have to accept that our professions are not, we're not isolated. We're part of a big interlocking set of institutions, and that the whole has got to change. Like, it's not working. The whole system is going to hell in a handbasket. I mean, if we think about um, climate change and all the rest of it, we got problems that require each profession to have its input politically. and that we can do what we can with our profession. Like, I think the recovery movement in psychology is a an improved approach to the problem of addiction and mental health. It's not so much disease oriented and not so much medication oriented, but more oriented towards creating a kind of a model of a society that works, and inviting people into it, and letting them feel comfortable and letting them develop in it. We can do a lot within our profession, but I I I myself am not content to look at to work within professional boundaries, simply because I think it isn't enough. And as I said, my primary example would be the policemen that I knew. I met these guys who were willing 30 years ago to stand up and say in a meeting of policemen, we cannot arrest our way out of this problem. We can't do it. And that means we've got to pass that idea outside their profession. We've got to, and there are police organizations which do that, which sponsor that idea, but they're not talking to other policemen. They're talking to the rest of us. And they inform people in other professions like me, for example. And so I think we have to think beyond what we can do within our profession, which doesn't mean we shouldn't consider what we can do in our profession. I mean, of course we want to be better therapists. Of course we do, and we can. So I think we can have it both ways, right? We can be better therapists, and we can be spokesmen for a group of people who have every opportunity to look at those people who we think of as having mental diseases. I mean, we're the experts because we get to talk to those guys all the time, and we can make some judgments about them that other people need to have, not just other psychiatrists and other psychologists, but other people in general.
I think at the end of the day, I was the one who was despondent with politics. Do you mind telling us how you got in touch with the concept of dislocation, and how was the bridging and looking at addiction from that perspective?
Yeah, well, I was looking for a word, and I ran into hang on, I'm going to remember his name, Karl Polanyi. Karl Polanyi is a 20th century historian, and he talked about the gradual breakdown over a couple of centuries of rural England in the Industrial Revolution, and his famous book is called The Great Transformation, and he's talking about how what was a fairly stable rural society, and it had plenty of problems, but people were, they had a reason to live. They had a place in their society. They had a sense of meaning. They were all very religious people, of course. They had a hierarchy, but it was a meaningful hierarchy. And then all that broke down with the Industrial Revolution, and these same people became, well, we went from, let's say, the peaceful hamlets of rural England to the great gin craze in London in the 18th century. At the same time, these people lost their traditions, their social traditions. They became vulnerable to a new drug. So here's a new drug from the Netherlands called gin, and it's like alcohol, only it tastes funny because it's got juniper in it. And well, so they go crazy, and madness sweeps through a whole city. And he used the word dislocation, and I take him to mean that it's dislocation in the as opposed to amputation. You could say that a person, you could amputate your arm, And that would be a terrible thing. Your arm wouldn't be any good anymore. But you could dislocate your arm and it would still be on your body. It wouldn't be missing, but it just wouldn't be able to work anymore. It wouldn't articulate with the rest of society. It would be like a dislocated joint. And his argument was that dislocation was the upwelling problem over several centuries there, that it's really the problem of the modern age. And you could say the problem of capitalism, or you could say the problem of technology, or various things, but really the problem of the modern age itself, that renders people alone even when they're together. So I think of that as the central problem. Now, why do I think of that as the central problem? Probably just because of my own history. Probably. But what I'm sure of is that there is a problem, that as the modern age progressed, as Polanyi and others have pointed out, problems like addiction like drug addiction, became way, way, way more severe and more frequent. Something is missing. And to identify as specifically as we can what it is that's missing and how it is to be replaced, I think that's the task. And I can't do it myself. I'm too old. I think it's gonna take a lot of searching, but my argument is that the focus needs to be there. We need to know what kind of a society would all these kids not be losing themselves in video games, or when they get older, losing themselves in TikTok or Instagram, or at various ages they lose themselves in various ways. What kind of a society gives them something better than those artificial attractions? And I think that is the central problem.
It makes sense. I like the definition a lot, and one, because it's very broad, and allows us to include, as I said, I like the overlaps between the thinkers. And I have a pen pal from Australia who recently sent me some videos of a geneticist or biologist, talking a very similar things from a biological perspective. And
Really?
well, yes, and he covers in terms of homeostasis and allostasis, and I don't remember his name right now, but I'm gonna email you the very presentation that he sent me about this guy. And and what he does is, and it's very similar to your take also in your book about Darwin and the societal, the social integration, actually, of being part of groups, of being part of an identity. I don't know. And that leads me to back to the effort of helping each patient of ours that is sitting in front of us and is suffering of things that we may want. We have the billing codes. That's pretty much what the DSM comes to, but the true diagnosis is always something else. Although you just need a little bit of depth, and you're going to find that patients tell you what's missing, what's going on. At times they don't know, but they can tell something's missing, and that leads me to this conversation about the personal responsibility, because and why I focus so much on it. Because if someone comes to me and says, I relapsed and I just came out of detox, and it's the third time I did that in the last 12 months. Well, you have a brain disorder. Or I'm depressed. Depression came back, just like if I'm saying my hiccups came back, right? As if it was my hiccups were an entity, just sitting in some part of my body waiting to manifest itself. I'm depressed again. And then I say something like, well, It's a biochemical imbalance. And if I don't say it, and my offer, and this, even if I don't say, but if I offer a pill as solution, I'm still putting the cause, the problem, and the solution out of the patient's hands. Now the responsibility is mine. So you come back in a month and we add another medication. I don't know if you have taken a look in how polypharmacy is going in America, but brother, there's always something else to add. And the other interesting thing is that despite how rich literature is saying this doesn't work so well as they claim, this doesn't work so well as they claim, we never get in touch with those. We only get in touch with the stuff that says it's okay to combine, because that's promoted. But I cannot prevent but say no. There's no biochemical imbalance because that puts things out of your hands, and there's no freaking pill because that also puts things out of your hands. You got to figure what's hurting and why, and we got to figure what to do to address it, which is a basic psychotherapeutic take if you think about it. And that's why I'm so into this concept of personal responsibility, because it was really subtracted from the clinical practice.
When I hear you saying this, I'm hearing Jordan Peterson saying the same thing.
And that's my question for you, because I know in your website, you one of the webinar, the seminars you gave, I think, a speech you gave, you mentioned about Dr. Peterson on personal responsibility, and I know you don't, I know you don't completely, you don't diss the idea, but you also point out the bigger picture of things. Can you elaborate on that thing?
Yes, I want to elaborate on this. Jordan Peterson is very cool. You know, I like to listen to him, and I like to absorb what he's saying. You know, it's what I do is my responsibility, and the more clearly I know that, the more careful I am, and the more judicious I am, and the better I will do my work. And so I agree with him up to that point. But I agree with rules 1 through 5. But then we get to rule 6. He's talking about the 10 rules for life, right? In rule 6, he says, okay, he says, until you've got your own life in perfect order, don't worry about society. Don't try to change society. And then I disagree, because it's not an either or. You can be as responsible as you can possibly be, and you must. I mean, this is our obligation, this is our ethical obligation as human beings, is to be as responsible as we could possibly be. But our life will never be in perfect order, because we're human beings. We will never be in perfect order. And that means we should, according to his rule number 6, that means we should never worry about society. But we have to worry about society, because everything we can do to provide support for people that enables it, that makes it easier to be responsible, is for the best. Like, you can't be responsible if you're born into abject poverty and you're raped as a child and all this stuff. 1 in a million people can, but the other 999,999 people cannot. So that it shouldn't be that all those millions of people are living in abject poverty and subject to that kind of abuse. That can't be true. We can't allow that, because it's simply cruel. And then we say to those people, well, you should be responsible. Well, almost none of them can, because it's just too hard. The scars are too deep, and the pain is too great, and the anger is too great. Now, of course, that's an easy thing to see. I think you would agree with that. I think everybody would agree with that. On the other hand, we know that problems like addiction are very common in people who are not raised in abject poverty, and they haven't been abused as children in those kinds of ways, but it's still hard. And why is it hard? That's the problem we have to solve. And it obviously has something to do with technology, right? The fact that people are offered all these distractions by technology. Every time you go on the screen, there's going to be a distraction here. Oh, look, she's taken off her clothes or whatever. There's all these things to distract you from what you're doing. We have to solve that problem because the rate of, now I'm speaking of addiction because this is my field, the rate of addiction among people who are upper middle class or wealthy is not that much worse than it is for the people who are in these conditions of terrible abstract poverty. It isn't just poverty that's the environmental problem, it's something deeper. And we need to know what it is. And as far as I'm concerned, Jordan Peterson can go to hell when he says, we shouldn't care about that. We should just care about reminding people of their responsibility, because it's really unkind, because most people are doing the best they can, and sometimes they can't, sometimes they just can't, and then so they're acting very badly. And there are social changes that can be made that will make it easier for more people to be responsible. That's my analysis.
I wonder if it's intended as because that makes a lot of sense, and I wonder if his claim is intended as an indirect good for everybody else, in the sense that, okay, if you're put together, if you're taking care of being a good spot, then you can serve. But I don't know. We'll have to hear that from him.
Have you viewed him?
Oh no, I haven't. So I talk to professionals, right? Well, that's my audience is of professionals, and I was considering my target audience, I was doing fairly well with Spotify, but now I moved to YouTube, and YouTube is just another speed, and I didn't know that. But I didn't know it's the second most used search engine. So clearly, as soon as I started to post on YouTube, I had, in terms of downloads, it was meaningful, like first episode meaningful, like I don't have to make any efforts. But he's more of a pop guy now, so I don't think think it's easy to get. And I also don't know if in the field, every time you transition from a professional level discourse to a more, even though his discourse is very professional and helped me understand a lot of things about Jung, for example, that I couldn't understand before. Once you move in that direction to this more pop level, you get kind of disregarded in the medical field a little bit. And so, of course I would welcome, but I have concerns about that. But that being said, I just want to point one last thing, at least if you have any other things to say, is I was reading your book, and brilliantly written, man. It's and you point out that addiction to political personalities is one of the most dangerous things we have in our hands nowadays. And as you're making that argument, you mention a few politicians in your book, and I'm not right or left, for the simple reason that I think the problems are too complex to be addressed by an ideology. But one of those names is someone that I would have voted for. And as soon as I read, I had this emotional reaction that unfortunately proved your argument to be a very good one. That we, as a society, we adopt this messianic picture of figures and people, and we become incapable of even questioning them, which takes this polarization that we have nowadays to another level. Because if you have a leftist shoot someone in the head, the left will say, well, here's his reasons. And the right's going to say, hey, what about that? And vice versa. It doesn't matter. It's just folks are lost to the facts, because they are. And when you put that as you point at that as an addiction to I'm not big into this thing. I was like, wait a minute. And I was like, ha. I had to sit back, and I was laughing for about 2 minutes of this thing, just laughing alone of the impact it had. I would tell it, if you have another edition of it, to to expand your argument, you put all kinds of names there.
Yeah.
You know what I mean? You put your guy, you put the left guys, the right guy, you put everybody there, because anyone reading of, because this is one thing I don't do. I don't talk politics in the show, because my business is to convince folks to fix what we're doing. And if I talk politics, immediately I'm going to lose half of my audience.
Yeah.
So I don't touch it. But when I saw the book, I said, "Oh my God, man, you got to expand this thing, because this is just the emotional experience of seeing someone you have voted for. It's a proof of your concept."
You know, it's fascinating to me in many ways. But what I have learned is that the one person you can talk about, and you're not going to hurt anybody's feelings, is Adolf Hitler. So I have spent a lot of time studying Nazis. For example, did you know that Martin Heidegger was a Nazi? There's like, the philosopher Martin Heidegger, who is well known by psychologists. I spent a lot of time studying Nazis, and I don't think that Nazis are horrible, evil people. I any more than I think of heroin addicts as horrible, evil people. I think of them as people who they've got nothing, and so they reach out and they grab for a lifestyle that makes sense, and everyone around them is supporting it, and it works for them. And of course it's dangerous. Of course, the end of that may be the end of the world, because the Nazi movement could have been the end of the world if they had gotten the atomic bomb first. There's no doubt they would have used it really quite extensively. But I know a lot of people who are locked into various cult leaders, political cult leaders, as I call them, and they're not bad people. They're just people who need something to believe, and this guy is making these enormous promises and these enormous generalizations, and they grab onto them, just like other people grab onto heroin or grab onto alcohol or grab onto video games. It's the hole that must be filled, and that's where, once again, I want our profession to say, look, this addiction problem is not just something that guys take too much OxyContin or too much this, or cocaine or whatever. That's not what it is. Goes way beyond that. People seize onto things way more dangerous than cocaine and OxyContin, like Hitler. And therefore, I want to say that our particular profession is much more important than we who are in it give it credit for, because that has to be understood. And we don't understand it. We just say, well, Hitler, of course, the guy is a lunatic, and anyone who followed him was an asshole. But that doesn't get us anywhere. We have to, like Martin Heidegger was a very, very smart guy. I don't know if you know who he is, but
Yeah,
sure you do. And he's a very serious philosopher, but he's a Nazi, and we have to understand that. We have to understand that, because that's the addiction of all of them, which could destroy us. Not to mention addictions to consumption and wealth and power and all these other addictions. And incidentally, when the great classics were written about addiction, let's say by Plato and by St. Augustine, They weren't writing about a drug addiction. They were writing about addictions to power and wealth and these really very terrifying kinds of addictions, and we're leaving it out. I think we have to very consciously broaden our horizons and very consciously take responsibility for not paying attention to what absolutely must be understood.
Bruce, thank you very much. It was a very, very nice conversation. I really appreciate you taking the time and